Here I am LAXMI SAHU, pursuing Masters of Arts in Applied Philosophy and Yoga, and today I am going to present a yoga module development and validation for sickle cell disease. So I want to thank Mrs. Manisha Mona ma'am for joining this presentation, and also thank to Mr. Rahul Adi sir for giving me this opportunity. And these all are my contents. So this is publication details, journal name International Journal of Yoga, published by Walters Clover Medno, and author name is Sayyid Zain Haider Jadi, Mithila MV, and Ramesh Najandya Mamathur, R. Nagratna, Arun Tulsi, Atmika Y, Ram Sahai, Katla Naresh, Himanshu Shukla. And impact factor of this journal is 1.6 and submitted on 31st August 2023 and revised on 2nd November 2023, accepted on 3rd November 2023 and published on 9th Feb 2024. In keywords used for this paper is anemia, module development, sickle cell disease, validation, and yoga. And Institutional Ethics Committee ACE Vyasa approved this the research, and financial support and sponsorship is provided by Ministry of Tribal Affairs, Government of India. So introduction, sickle cell disease is a genetic blood disorder that affects the shape and function of red blood cells, which can lead to several health problems affecting the quality of life. SCD can be treated with certain expensive treatments such as RBC transfusion, hydroxyurea, stem cell transplantation, gene therapy, or bone marrow transplant. However, some of the most common symptoms such as pain, anxiety, and stress can also be alleviated with alternative therapies like yoga. In light of this, there is a need for the development of a specific yoga module for SCD that can complement the current therapies. Justification of the study, yoga practice have been found beneficial for lifestyle diseases and several psychological disorders. Furthermore, the beneficial role of yoga in elevating the most common clinical symptoms experienced in SCD, such as pain, oxidative stress, and inflammation, and also psychological distress such as anxiety, depression, and general stress is well documented. Yoga can play a vital role as it is found to be beneficial in regulating emotion, encouraging coping behaviors, and enabling better stress management. Yoga practice, especially those that involves meditation and deep relaxation techniques like mind sound resonance technique MSRT and yoga nidra, have been shown to significantly improve sleep quality and fatigue levels. Yoga-based relaxation training normalizes the function of the autonomic nervous system by deviating both sympathetic and parasympathetic indices toward normalcy, and also by reducing cortisol levels. All in all, by adapting to a yoga-based lifestyle intervention, there are several benefits for the SCD patients that could drastically improve their quality of life in the most cost-effective way. This study aims to develop and validate a yoga module for sickle cell disease based on both scientific and ancient literature, which makes the intervention more comprehensive and robust, which not only addresses pain as seen in many of the previous studies, but also has the potential to manage many of the debilitating symptoms of SCD in the long term. Yoga module. So what is yoga module? A yoga module is commonly understood as a set of yogic practices incorporated synergistically within a specified time to achieve a goal. The authors differs in their views on developing and validating yoga modules. Yoga module development usually follows a process that starts with a search in scientific and traditional literature to identify the appropriate practices. Opinions and consensus from experts about this practice help in validation. The Delphi process of iteration or lossy content validity ratio has often been used to validate the developed yoga module. The feasibility of the module is tested to assert its practicability. So what is sickle cell disease? Sickle cell disease is a genetic blood disorder that affects the shape and function of red blood cells, which can lead to several health problems affecting the quality of life. SCT is caused by mutation in the beta globin gene, resulting in the polymerization of hemoglobin, eventually leading to sickling of red blood cells, which has wide-ranging implication on the body: chronic hemolysis, vasoacclusion, chronic pain, progressive end organ damage, and reduced life expectancy being some of them. Despite its hereditary causes, several factors contribute to the severity and frequency of signs and symptoms of the disease, including infection, exercises, socioeconomics, air quality, and climate. And here we can see the symptoms of sickle cell disease and how this sickle cell looks alike. And this insightful pathophysiology prevalence worldwide, there are 300,000 children born with SCD every year, and India has the second highest SCD burden in the world, with a prevalence in some tribal groups reaching up to 40%. Pharmacologic treatment: bone marrow transplant is the only available cure for SCD patient. At present, apart from his other treatment option, available are drugs that manage the symptoms of pathophysiology of SCD, like voxelotor to prevent the sickling of RBCS, crizanlizumab, TMCA to reduce vaso-occlusion, and hydroxyurea to reduce or prevent multiple complications. And long-term complication of this pharmacologic treatment is these drugs have been associated with common side effects, including neutropenia, bone marrow suppression, elevation of hepatic enzymes, anorexia, nausea, vomiting, and infertility. So, ancient and scientific literature review to develop this yoga module has been done. So, these all the practices: loosening and warming up stretches. Benefit is loosening practices in general have shown to improve blood flow throughout the body and help in warming up. So these practices has hand in and hand out, breathing, hand stretch breathing, rabbit breathing or dog breathing, Sasankashan breathing, tiger breathing, spot jogging, forward bend, backward bend, and side kicks and twisting. So, and Pavan Muktashan Kriya. So, relevant benefits is it helps to improve mobility by loosening the joints and thereby prevent risk of injuries. And it improves the oxygen uptake, reduce muscular pain, and enhance performance by reducing fatigue. And sport jogging has benefits, certain psychological benefits like reduced stress and anxiety are also found. So after it, Surya Namaskar. Surya Namaskar in general balances the metabolism and stimulates the reproductive, circulatory, respiratory, digestive system, and endocrine system. And Surya Namaskar synchronized breathing and body movement increases mental clarity by bringing fresh oxygenated blood to the brain. Surya Namaskar increases the mobility of the joints, enhances muscle strength, endurance, cardiorespiratory efficiency, and lung capacity, and has shown to increase alertness, attention, and short-term memory when combined with other yogic practices. And asana included Ardha Chakrasana, Ardha Kati Chakrasana, Padhastasana, Vajrasana, Gomukhasana, Bhujangasana, Salbhasana, Sarvangasana. It has benefited significant improvement in psychological well-being, including changes in depression, anxiety, positive and negative effect, and pursued stress. Asana alters the flow of blood and nervous impulses in the pelvic region, and it strengthens the pelvic muscles. Physical practices shown to be acceptable, feasible, and helpful intervention for hospitalized SCD children with vaso-occlusive crisis, and decreases oxidative stress and improve antioxidant status, lowers stress and pain by down regulating the HPA axis and stimulating the vagus nerve. And Kriya and Pranayama included sectional breathing, abdominal, thoracic, clavicular, and full yogic breathing, Kapalbhati and Bhastrika, Nadi Suddhi, which is alternate nostril breathing, and Bhramari Pranayam. So it has benefits. Stabilization of mind occurs when breath is steady. Breathing practice reduces anxiety and negative effect through modulating brain activity and connection in emotion processing. Attention and awareness regions profoundly affects the parasympathetic nervous system, and single nostril breathing helps to calm and the sympathetic nervous system, reduces oxidative stress and decreases airway resistance, increases respiratory muscle endurance and oxygen diffusion. And meditation or relaxation technique included IRT, DRT, QRT, DRT, and it has benefits. Meditation and relaxation helps in the management of stress and depression. Patients who received QRT, which stand for quick relaxation technique, reported less pain than the control group. Yoga Nidra and relaxing music have been found to reduce discomfort during colonoscopy. And Yoga Nidra or MSRT stand for mind sound resonance technique. Relaxation techniques reduces anxiety symptom in patient with sickle cell disease. So criteria for validation of this yoga module is the 70-minute yoga module was validated by 33 yoga experts with an average of 8.75 years of experience in teaching yoga therapy and research, and 88 potential experts were approached. Out of them, 37 responded and 33 met the eligibility criteria. So this is the eligibility criteria for expert validation. A PhD in yoga or master's degree in yoga with a minimum of 5 years of experience, or Bachelor of Naturopathy and Yogic Sciences BMIS degree with a minimum of 5 years of yoga therapy experience. So details of experts in focus group discussion for module design. The total number of experts in focus group is 14, and qualification is 11th with PhD in yoga. Among the 11, one held an MBBS degree, another a BNMIS degree, and a third had a BAMS degree. 3 with MSc in yoga, and therapy and teaching experience is minimum 5 to 10 years, and average year of experience in yoga research therapy is 13.28 years. And social demographic details of validation expert is gender distribution. Years of experience in yoga minimum is male is 10.5, female is also 10.5, and total mean is 10.59. And years of experience in yoga therapy is 8.8 in male, 9.5 in 9.05 in female, and 8.86 total. And educational year of experience in yoga research is 6.7 in male, female has 6.8, and total is 6.78. And educational qualification, PhD, 9 males done PhD and 7 females have PhD, and total 16. And post graduation, 8 in males, 8 in females, to total 18. So yoga module for SCD with their content validity ratio scores is Sukshma Vyayam included Sukshma Vyayam loosening exercises. Number of experts marked 28. It essential, not necessarily necessary but not essential 5, and not necessary 0. So its content validity 0.7 is accepted. And breathing practices, hand in and hand out breathing, hand stretch breathing, it is also marked essential by 30 experts and not necessary by 3 experts. So with 0.2 CVR, it is accepted. And rabbit breathing and dog breathing, it is marked by 15, it is accepted. And 18 experts suggested it is not essential, so it is rejected. And Shashankashan breathing, it is also accepted by 0.64 content validity ratio. Tiger breathing, 1 minute and 6 rounds, it is also accepted. So, sir, I have to continue all this. Sir?
No, you can go next.
Yes. So this is also the exercises which is by content validity ratio decided it will be accepted or rejected. So advantage of CAM therapy, which is complementary and alternative medication therapy, they take into account the lifestyle, dietary habits, and psychological well-being. And this type of lifestyle intervention approach enables the patients to become more involved, empowered, and educated about their health, making it more impactful in their daily lives. And limitation of the lifestyle intervention is lack of insurance policy covering these therapies, a lack of funding for conducting research and developing infrastructure, integrative treatment centers for SCD, and lack of awareness regarding the availability of such therapies, especially in rural and remote areas where the prevalence is highest in India. And healthcare professionals also needed to get familiarized with, educated about such lifestyle intervention for them to proactively recommend them to their patients. And moreover, there is a need for evidence-based research to bring such therapies to the forefront and make them more acceptable as a treatment modality owing to their cost effectiveness and long-term benefits. And strength of the studies, the uniqueness of this study is that the framework developed was validated by multidisciplinary experts, where one expert had an MBBS degree, one doctor with a BMS degree, and one doctor with a BMS degree, and others from the field of yoga therapy, yoga research, and SCD patients who are yoga practitioners. The present study describes the development and the first development and validation of a yoga module for SCD, making it the first validated module for SCD. And the current study is taking its first step toward generating scientific evidence by way of the methodical.
Next is Lakshmi, I think.
Yes, sir. And yes, methodical development of an intervention and validation of the same, which in the future will be used for SCD patient as an adjunct therapy alongside the standard of care to understand its efficacy and biological mechanism. And results, 17 minutes module developed by the focus group had in total 27 practices, including loosening exercises, asanas, pranayama, relaxation techniques, and meditation. After validation by the experts, 21 practices with a content validity ratio is greater than 0.33 were retained. The predominant reason for including 12 practice was intensity, which may have some adverse effect on sickle cell comorbidities. And conclusion of this study is a scientific literature and traditional text-based yoga module for SCD patients was developed, which may benefit SCD patients by potentially reducing pain, inflammation, oxidative stress, improving oxygen saturation, and improving cognitive ability. 33 experts who agreed with the majority of practice validated the yoga module. And why this paper is useful, my research plan is due to the very short lifespan of RBCS, SCD patient face the situation of anemia, which causes vaso-occlusion, liver damage, fatigue, etc. And this study described the first validated yoga module, including asana, pranayama, meditation, etc., which may increase the lifespan and numbers of RBC. And I would like to acknowledge the contribution of Mr. Rahul Aje sir, research scholar of ACE Vyasa, and Ravi Maletha sir, research scholar of ACE Vyasa, and Miss Ruchi Goswami ma'am, research scholar of AIMS Delhi, for their support and mentorship in this paper presentation. And these all are the reference of the papers used in this yoga module development. Thank you, sir. It's done.
Yeah, nice presentation, Lakshmi. Yeah, Manisha ma'am, she will ask.
Presentation is good, Lakshmi. Okay.
Yes.
So I'm asking you a few questions. First, you tell me how a yoga module develop. Means I'm asking the methodology section, that how we can develop a yoga module.
Ma'am, for developing the yoga module, we use two methods, Delphi methods or lossy content. So the number of experts of yoga.
We start from the beginning. Means before validating a yoga module, what you will do? What is the first process? What is the first step you will do?
First step, ma'am, first we will.
MDYA comes after, na? First you will do a ancient literature review,
Yes.
then modern literature review, and after that content validation or CVR will come. Na? So first you have to search for the literature review, either from the ancient literature review or the modern literature review, right? After that, second step,
we will ask the experts for their review.
but after means after the ancient literature review and modern literature review, we will plan that what are the means what are the asana, what are the pranayam we will give to the patient according to ancient literature review and modern literature review, right?
Yes, ma'am.
And after that, just think, because you are presenting a yoga module, no? You should know that what is the means how you develop a yoga module.
Yes, ma'am. We will plan the intervention, what we will provide to the patient, and after it, we will ask the group of experts to give their points or to
Feedback, right?
yes, it is beneficial or maybe not beneficial for the
You have to
patients.
justify also.
Yes.
After meeting, first you have to do a ancient literature review, modern literature review. Then you will plan what are the asana, what are the pranayam, or what are the things you will include in your study. Okay.
Yes.
And after that, you have to justify also why you are giving this module. Means why you are giving this asana, why you are giving this pranayam. You have to make proper justification. That from the ancient, if you are taking from the ancient literature review, so in Geran Samhita, this is written in such and such. In Patanjali Yoga Sutra, this is written, means you have to justify that statement, right?
Yes, ma'am.
And after that, you will prepare a module. Just think, see, this is not a means you are presenting, this is your initial phase. That's why I'm giving you these things, that first thing what you have to do, second thing what you have to do. Directly we don't go for CBR ratio.
Yes,
Okay,
ma'am.
CBR ratio comes in the last. Okay. So
Yes,
tell
ma'am.
me the first process. What is the first step?
Scientific and ancient literature review.
Fine. Second step.
We will plan the intervention.
Okay. Third step.
And
After preparing the Google Sheet or whatever you have, means how you will send through the means of offline mode or online mode. It will depend upon you how you will take the means how you will send the your this module to the expert.
to the
It
experts.
is written that 88 is we are the researcher approach. 88 is expert. Out of 88, only 33 are eligible. Okay, so
Yes.
based on inclusion and exclusion criteria, you have to mention these things. Okay, after that, CVR ratio will come. Means that is content validation by the expert. Okay.
Yes,
My second question is what is the best practice out of the entire yoga module? Which is the best practice for sickle cell anemia patient?
ma'am, MSRT.
Why?
Sorry.
MSRT, right? Why?
Mind sound resonance technique, because it relaxes. It is a part of meditation, and ma'am, maybe it is got the highest content validity ratio because of the benefits of MSRT.
Because of the benefit of the MSRT. Okay, tell me one thing. How do you calculate CVR ratio?
CVR ratio, ma'am, we will ask the experts. After their justification, we will conclude how many of them has accepted and how many of them rejected. So by this we can decide the CVR.
No, how do you know? If suppose 33 persons, 33 experts have validated the paper. So how do you know your CVR ratio?
Ma'am, by calculating the average.
No, means something is missing.
I'm sorry, ma'am, I don't.
No, actually CVR ratio is fixed. Suppose 33 experts have given, na? So lossy paper is there, research paper. On that paper, it is clearly mentioned if that much expert have given the means opinion or advice. So what will be the CVR ratio is always fixed based on the number of experts.
Okay.
And minimum minimum expert requirement for any paper validation is 10.
Yes.
Minimum 10 expert is required for any paper validation, for any module validation. Okay. So CVR ratio is always fixed based on the number of experts. Okay. After that, we are calculating the formula that it is means for 33 expert, the CVR ratio is this. So if for this means suppose you are taking the asana, pranayama or anything, after that we are calculating that it should be there or not. The CVR ratio is always fixed. Okay, right?
Yes, ma'am.
Okay. And my next question is, what is the alternative treatment for sickle cell anemia?
Ma'am, acupressure
Hmm.
and naturopathy
Hmm.
and or massage
Hmm.
and yoga. This is the complementary and alternative therapy for SCD.
Okay. Can you say something about sickle cell anemia?
Ma'am, sickle cell anemia is a condition where due to the lack of the number of RBCs, the patients have the low number of RBCs. It is called by this they face the condition of anemia.
Hmm. So why it is called sickle cell anemia?
Ma'am, we have the our RBCs have the shape round shape, and in sickle cell disease, the patients have the sickle cell RBCs. That's why we called it sickle cell anemia. We can see here it, ma'am.
Very good. The shape of the RBC is become sickle-like. That's why it is called sickle cell anemia. Right. Very good. Okay. So that is enough for my side. Okay. So now I think Rahul.
Yes. Yeah. Lakshmi ji, and first of nice presentation. And one point I add here that you were reading one by one words. No, in the presentation, it is the not good style to giving any presentation. No need to read all the words.
Okay, sir.
Make fix the limited words in the presentation. Okay, no need to all read. Okay, you have to give the overview only on the slide. And because of that, sometimes you also confuse that which slide you were reading. As like we tell na कि that रट्टा मारने वाला वही काम हो गया ना आपके साथ. रट्टा मारने वाला आपको नहीं पता कि आप कहाँ से पढ़ा रही थी. You yourself you confuse which slides you were teaching ना. अगर समझ के करती तो शायद वो कंडीशन नहीं बनती आपके साथ. तो इससे साफ साफ पता चल रहा है ना. That's you are not understanding properly. You are depending on the words. You are not giving words by yourself. Yeah. Sometimes one or two times that in picture presentation that this sickle cell, yeah, you give few words from your sides, but in other slides completely you were reading the words. It is not good style of the presentation. Improve it, okay?
Yes, sir.
And the last important thing is that first, yeah, last slide. Why you selected? Please show me that slide. What is it? Are you really thinking it is enough? Why you selected this paper? Please read it again. What is it?
Due to the very short lifespan of RBCs, ACD patients face the situation of anemia, which causes vaso-occlusion, liver damage, fatigue, etc. And this study described the first validated yoga module, including asana, pranayam, meditation, etc., which may increase the lifespan and number of RBC.
It is about the study. And what is the title? Why this paper is useful for my research plan. What's your research plan? You did not mention here. Why? Completely wrong, na?
Yes, sir.
So you have to mention that I want to work in the sickle cell area. That's why I selected this paper. Yeah, or I'm interested to develop any module. That's why I selected this paper. So this kinds of lines should be here, no?
Yes, sir.
Okay. Next is that I told that one line. The one slide is missing here. That is critical evaluation. Where that slide, critical evaluation by you, what you got the mistakes or any things from this paper. The slide is not here. Why?
Sir, I didn't got it.
Critical evaluation, it's very, very important, no? That is the actual summary of your presentation. Otherwise, it completely comes copy paste and complete presentation. It is not good. That evaluation is the main part. What is the mistakes there? Okay, what's the strengthening there? Add by your side, not the exactly copy from paper side. That is the critical evaluation by you. Okay.
Yes, sir.
Okay. Show me the other go to website. Go to website. Yeah. So it that words is here downside. Down. Can you make it full screen one by one? You can change, yeah. Go next. Next. Yeah. Okay. Next. Here. Yeah. Here. Go to backslide. Okay. It is the inclusion criteria, no?
Yes, sir.
Any exclusion is there?
Yes, sir.
What is it? You did not mention.
Sorry, sir, I forgot it.
You are missing major points, no? Okay, go to
Yes,
next. Here is no back. Here you mentioned the upside. There is 13.28 average experience. Okay,
Yes, sir.
and go to one more back slide. Here is 8.75. What is difference here? Can you explain?
Sir, it is the total number of experts in focus group is 14 and it is 33 yoga experts.
Okay.
So I think there is the difference.
Okay. Okay. Other thing is fine. Okay, so you are in the, as Manisha ma'am told, beginner stage. So okay, we can consider it, but improve the presentation styles. So it's necessary to understand you. Okay.
Yes, sir.
Okay. Now you explain why this paper is useful for you. This presentation is necessary for you. Why selected only this paper? Now explain.
Yes, sir. We found that study has shown that sickle cell anemia patients have the less number of RBCs, and the lifespan of RBCs is only 20 days, and the We have the normal people have the 120 days of lifespan of RBCS. If we will practice the pranayama and yoga, so study has shown that the yoga practice may increase the hemoglobin, blood hemoglobin level. If our blood hemoglobin level will be increased, the number of RBCS will also increase. So we will.
What is my question? You are explaining. My question is that why this presentation is important for you?
Sir,
Why
this is
you
this
selected only this paper? Why not others?
sir, this describe the first validated yoga modules. That's why this is important.
Do you want to develop module in future?
Yes, sir. I want to work in pranayama.
Then why you selected that validation module? Why not
Sir,
pranayama
because
paper you selected?
sir, because this module describes the which pranayama we will use. So that's why this is important.
Okay, 50-50 satisfying. I think by mistakenly you selected this paper. I think it's not your goal, na? Your goal is others. Okay, nice. Yeah, now I request to other students, if anyone have any kinds of doubt or questions, they can ask to Lakshmi ji.
Acha, Lakshmi, I have one more question.
Yes, ma'am.
What is focus group?
Focus group.
In your slide, it is written a focus group. What is focus group here?
Sorry, ma'am, I don't know.
Okay, this is your homework. What is focus group? Okay.
Yes.
And when you are telling this, if you wanted to tell her that why this paper is important, this is a very, when you are going to give your PhD entrance examination, so many times this question will be asked from you, why you have to have taken this topic, what is this reason behind this. So as a research scholar or as a as you are in masters now, so you have to make a very, the presentation should be on the statistically based, means what is the prevalence of sickle cell anemia in India.
Yes, ma'am.
Okay, what is the prevalence? And that's why because of this means the population ratio in India is such and such, and this is affected in the tribal area. And yoga is a we are not means for practicing yoga. Suppose someone is taking medicine or something, they have to pay. But this paper is based on the tribal area, so yoga is a free of cost, means they don't have to pay. Less means these are the benefits of yoga. Whenever you are doing research in yoga, you can mention these points.
Okay.
In any paper that yoga is free of cost. They don't have to pay anything. It require a less space. Okay, it is associated between your mind and body. So these points are common in all the yoga research. You can mention. And the first point is that what is the population? That's why such and such population is there, and such and such population is affected by sickle cell anemia. And because of this, I'm interested in this topic. Like this, you have to represent your interview.
Yes, ma'am.
Okay.
Yes, ma'am.
Yes, Madhu ma'am is raising hand.
Yes. Am I audible?
Yes, ma'am.
Sir, I have a doubt on what basis in this study shows a person for expert validation. On what basis? Like here mention that expert must be PhD in yoga, masters in yoga, BNYS, 5-year yoga therapy experience. So I am a bit confused about BNYS. Means in
BNYS
future.
stands for ma'am Bachelor of. Yes, Bachelor's of
Okay, but
Naturopathy and
what's the
Yoga.
need of BNYS professor or expert?
Ma'am,
It is a
yeah,
qualification. Here, I think it is the qualification, because if that the teacher, who is expert, who is more qualified, more experienced, So for example, if anyone who is master and who is BNYS, so commonly because BNYS, it is the science study of the yoga. So he is the more knowledgeable. And MBBS, he has the more medical knowledge, and now he is doing yoga in PhD. So common understood, he can correlate more well the yoga correlation with medical science. That's why qualification is necessary here.
Okay, it means if someone pursued masters in yoga or PhD in yoga, or he is 5 or 10 years yoga therapy experience, so he is not expert valid, cannot
No,
give expert
also
validation in this.
5 year more. It's depend on your criteria. You can reduce or enhance that criteria. You can fix 10-year criteria also. You can fix 1 year criteria also. I think 5 year it is common ratio. I think Manisha ma'am can explain more well about it. So it's depend on you because it's your module what you want to develop, right? Right, Manisha ma'am?
Right, Rahul. Actually, means like someone is working on sickle cell anemia. Okay, so sickle cell anemia means this is your criteria. You have to find out that because in some of the means what I have read or what I gone through the several papers of the yoga module, that it is based upon your choice, not your choice, but the inclusion criteria should be there, which will be benefited for your yoga module. Okay, so inclusion criteria you have to include that either doctors are also required or not, because someone is developing a module on CKD, chronic kidney disease. So for her, she has taken validation from the doctors also, 5-6 doctors. Okay, because in the ancient literature review now many things are missing. So it is totally based upon your criteria. This what type of topic you are taking and how that person or how those experts are benefited for your study or not.
Okay, thank you, ma'am.
Okay.
Yeah. To maintain the quality that you can fix the background also, because most of the students who are PhD, they did PhD from the theoretical topic. How they can give right that evaluation? They cannot do. They have no experience of practicality, experimental research, medical. They are very weak in the medical studies. How they can give the their comments? So it's you will fix, so that evaluator should be that background. If that background only, I will accept his comment, otherwise I will not accept. So that background is necessary, otherwise most of in the north area, in our north universities, most of them, they do not focus on these kinds of things, or that's why their modules are not good, and very bad results and non-significant results we received. No, so those studies who focus properly inclusion and exclusion criteria strictly, then only that module get the right and in the good direction. Okay, we should focus right in the inclusion exclusion. Very very important. Who is giving the comments? You are also the PhD scholar. You are also MSc. If I give the sickle cell disease criteria to you, can you give the comments? You cannot give because you have no experience. But you are master. But you cannot give comments because you have no background of sickle cell disease or medical. That's why that BNYS, they have very good experience of medical science. MBBS master has less as comparison to them. Yeah, PhD. Now here they should also mention, I think, PhD in which background. That is also, as per my best experience, they should mention that which background PhD they did, experimental or theoretical. Okay, overall that we should make. Okay, Madhji?
Yes, sir.
Yeah. Any other students? Yeah, others are no questions.
No, sir.
Okay. Yeah, yeah. Thank you. Nice presentation, Lakshmi ji. So it's your first presentation and you presented well, as you gave your best. Every time mistakes there. So congratulations to you. And next steps to the synopsis presentation. Start to prepare the synopsis and hope you will prepare soon. And same we will see in this same platform. Okay. Yeah, if it is related with sickle cell disease, then Jaim Bhaiya will be there.
Yes, sir.
Okay. Yeah. Okay. Thank you, Manisha ma'am, for your valuable points. Thank you to all.
Thank you. Thank you.
Very nice presentation, Lakshmi ji.
Thank you, sir.